Depression is a serious mental health condition that affects millions of people worldwide. Research into the causes and treatment of depression is ongoing, and new findings are constantly being published. Some recent research on depression includes the role of inflammation in depression. Some research suggests that inflammation in the body may play a role in the development of depression. This research is still in the early stages, but it could lead to new treatments for depression that target inflammation. The effectiveness of cognitive behavioral therapy, CBT, that's a form of talk therapy that focuses on helping people change negative thought patterns and behaviors. Research has consistently shown that CBT can be effective in treating depression, and it is often considered a first-line treatment for the condition. There is growing interest in the use of technology such as apps and virtual reality to help treat depression. Some studies have shown that these technologies can be helpful in reducing symptoms of depression, but more research is needed to determine their effectiveness. Researchers identified a number of genetic risk factors for depression, and scientists are working to understand how these genes interact with environmental factors to increase the risk of developing depression. This research could lead to new treatments that are tailored to an individual's genetic profile. It is important to note that depression is a complex condition, and research is ongoing to better understand its causes and treatment. It is always important to discuss treatment options with a qualified healthcare professional. Living with depression can be challenging and overwhelming. It is a serious mental health condition that can cause a wide range of emotional, physical, and cognitive symptoms that can impact every aspect of a person's life. One of the most common symptoms of depression is a persistent feeling of sadness, hopelessness, or emptiness. This can make it difficult to enjoy activities that were previously enjoyable and can lead to a loss of motivation and an interest in daily life. Depression can also cause changes in sleep patterns, such as difficulty falling asleep or staying asleep or sleeping too much. It can also cause changes in appetite and weight and may lead to a loss of energy and fatigue. Cognitive symptoms of depression, such as difficulty concentrating, remembering, or making decisions, can make it challenging to complete tasks and make it difficult to function at work or in daily life. Depression can also cause feelings of worthlessness, guilt, and may lead to thoughts of death or suicide. Living with depression can be isolating, as it can make it difficult to connect with others and maintain relationships. It can also impact a person's physical health, as depression is linked to a range of physical health problems. Despite these challenges, it is important to remember that depression is treatable, and there are a range of treatment options available. Seeking help from a qualified healthcare professional and finding support from friends and family can be crucial in managing the symptoms of depression and improving quality of life. The most common mood disorder in the world is major depressive disorder. It occurs when you have symptoms of low mood or hopelessness for at least 2 weeks and is also known as clinical depression or simply depression. Scientists are still baffled as to what causes it. They are aware, however, that treating it is complicated and that people who have it require more ways to feel better faster. For nearly half a century, scientists have worked hard to improve medications that target a small number of neurotransmitters. These are chemicals in the brain, specifically serotonin, norepinephrine, and dopamine, that affect how nerve cells communicate with one another, affecting your mood. The majority of people respond to standard antidepressants. However, at least 30% of people who try 2 different types of these drugs continue to have depression symptoms. This is known as treatment-resistant depression. As scientists' understanding of the brain biology behind depression has evolved over the last 2 decades, so has their thinking about treatment for major depressive disorder. According to Gerald Sanacora, director of the Yale Depression Research Program in New Haven, the most significant change is that medication research has progressed beyond simply targeting specific neurotransmitters. It has long been assumed that depression takes weeks or months to resolve. However, new fast-acting treatments have changed what we think is possible in the field, according to Sanacora. Brexanalone was approved by the FDA in 2019. It is the first medication designed specifically for postpartum depression, a type of major depression. Experts are unsure of how it works. However, it is a man-made version of a steroid that your body naturally produces. It has an effect on your GABA receptors, which help regulate your mood. Brexanalone is more difficult to take than other antidepressants. It is administered over the course of 60 hours through a vein in your arm at a medical facility. However, it is capable of working quickly. Your depression symptoms may even begin to improve by the end of your treatment. In the same year, another game-changing drug was also released. Esketamine is a nasal spray that requires a prescription. The low-dose psychedelic drug increases glutamate activity in areas of your brain associated with mood. The function of glutamate is to excite cells in the brain and nervous system. Esketamine can also create new neural connections to form in your brain. According to Sanacora, you may notice improvements in your depression within hours or days of using it. Esketamine provides people with suicidal thoughts with life-saving hope and people with treatment-resistant depression with some relief. However, symptom relief may only last a few weeks if used alone. As a result, experts agree that you should take rapid onset drugs in addition to traditional treatments. Sanacora still recommends cognitive behavioral therapy first for those with mild or moderate depression, followed by conventional antidepressants, also known as selective serotonin reuptake inhibitors, or SSRIs. Doctors still require more information on the safety of long-term effects of newer depression treatments. We've seen a transformative change in the way we treat depression over the last 20 years, Sanacora says. However, we still need to smooth it out to understand which patients benefit from these treatments and when. Medications aren't the only option for treating depression. Electroconvulsive therapy has been practiced for over 70 years. It is still one of the most effective treatments for major depression, especially if other treatments have failed. While the procedure isn't new, scientists have refined it over the years. Electroconvulsive therapy now consumes less energy than it did previously. The goal is to provide you with the same benefits while having a less negative impact on memory and thinking abilities. That's a huge improvement, says Susan Conroy, an Indiana University School of Medicine psychiatrist and neuroscientist. Conroy also treats depression with transcranial magnetic stimulation, which has fewer side effects than electroconvulsive therapy. It functions by sending magnetic pulses around your head. According to Conroy, brain tissue translates these signals into electrical energy, which changes how different areas of your brain communicate with one another. We believe that changing the circuitry is how transcranial magnetic stimulation helps people recover from depression. These and other types of brain stimulation are not suitable for everyone. However, if other treatments are ineffective and your depression prevents you from performing other daily activities, you aren't eating, and you have suicidal thoughts on a regular basis, you should consult your doctor. These are all indicators that your treatment needs to be escalated quickly, Conroy says. There are numerous other promising treatments for depression on the horizon. Deep brain stimulation is one example. A surgeon implants electrodes in your brain during this treatment. These nodes deliver painless zaps that disrupt the electrical activity that is causing your symptoms. You can consider this treatment to be a mood-controlling pacemaker. While it is not yet available to the general public, it may be soon. Technology is advancing at a breakneck pace, Conroy says. SAGE-217, a drug, is also being studied by researchers. According to Sanacora, there is interest in how it might help people with a history of depression avoid a serious relapse. The idea is that you would take it as soon as your symptoms returned. However, you don't wait until the symptoms are severe, he says. There's also a lot of excitement surrounding drugs like Psilocybin. According to studies, these magic mushrooms can relieve depression about as quickly as ketamine. with effects that may last longer. We need a lot more research before we can say anything with confidence, Sanakura says of the use of psychedelics. Sanakura says he's never seen such enthusiasm for depression treatments in his 25 years in the field. However, this does not imply that researchers have all the answers or that major depressive disorder can be cured. Medication, various types of talk therapy, regular exercise, a healthy social life, and a good sleep routine are all possibilities to help with depression.